Namaste, Salam Alaikum, good morning, good afternoon, and good evening, friends. I'm Radha Paudel, author, activist, and founder of Global South Coalition for Dignified Menstruation. I'm speaking from the Secretariat Office of Global South Coalition for Dignified Menstruation based in Kathmandu, Nepal. It is a global network to change the narrative around menstruation from the 5 days leading to life cycle approach and from hygiene to dignity. This is global network initiated by the survivors and activists from the Global South in 2019. It is started spontaneously from Global South, therefore it has been struggling to get support. However, we are moving forward to create the space for dignified menstruation, to examine and address the menstruation through the human rights lens. We have been doing webinars, online research, publications, conferences, and trainings at regional and global level through the friends and organizations who are passionate and committed towards dignified menstruation. Today is October 18, a special day to commemorate for us. That is International Menopause Day. For Global South Coalition for Dignified Menstruation, today is Dignified Menopause Day. It is other side of the Dignified Menstruation campaign. For extensive discussion on dignified menopause, we have a speaker all the way from UK. She is Diane Danzebrink. She has so many hats to describe her. To us, she is one of the pioneers for making menopause matter, not only in UK, but also globally. More importantly, she is a close ally, close sister of Global South Coalition for Dignified Menstruation. She is always with us whenever we need it. We are very honored and humbled to have her today. Let's welcome to Diane.
Hi, Radha.
Thank you very much for allocating the time for us. It's very tough for you, I know.
My pleasure. Absolute pleasure. It's lovely to see you again.
And I've been go through your website and there is a message. I'm sorry, but I'm currently unavailable to work with private therapy clients, and I'm really scared by reading this message. Though you are here and we are so happy and proud, would you explain a little bit about your the work, what you have been doing right now, or in other words, your extensive introduction? I feel I'm a little bit nervous. I may not explain well, so I'm requesting you for your introduction.
Well, you explained beautifully, but I'm very happy to expand on that. So, hello, everybody. It's a pleasure to be here talking to you. I'm the founder of an organisation called Menopause Support. So that's menopausesupport.co.uk, and also of our national Make Menopause Matter campaign. So the reason that I started to work in this area is very much related to a personal experience. So it's going back a long way now. It's going back to 2012. So 11 years ago, I went into a surgical menopause. So this is where both of the ovaries are removed at the same time. But unfortunately, I wasn't given any information about surgical menopause by the medical team, either before or after my surgery. So I had no idea about the potential number of symptoms, and I had no idea that menopause could, for some people, mean changes to their mental and emotional health. And for me, that's exactly what happened. That took me to a very dark place in my life, took me to a real crisis point in my life. I was very lucky that I had somebody in my life to help me to get the support that I needed. But when I did start to feel a little bit better, I started to research. I started to wonder, was I just unlucky? Or were there other people, not just in the UK, but around the world, who were struggling due to a basic lack of information, care, and support? And what I found absolutely horrified me. I was so shocked by the amount of people that I came across who were saying, I don't feel like me anymore. I feel like I'm going mad. I'm struggling in all aspects of my life. And I just thought, this is ridiculous. You know, we're half of the population around the world. The world population currently has just gone over 8 billion people, and half of those people are going to experience menopause. And we are doing such an injustice to those people. Just improving education for the public and for our health professionals would make such a difference. So I've started very much where I live, which is where I can make the biggest impact. And we have a campaign that's campaigning for better education for all our healthcare professionals, particularly our GPs and our medical students. We're campaigning to have better guidance and support in the workplace, for there to be a public health campaign, but also for menopause to be included in the school curriculum alongside periods and pregnancy. So we have already made changes. We've already made advances. Menopause is now on the curriculum in schools in England. And we also know that from 2024, all of our medical students will now be taught about menopause. But all of the things that are changing here in the UK, I want to see change around the world too. And I'm so delighted that there are more and more people around the world who are raising their voices to say we need better information and support here too. So that's really what I do. I'm very much an activist, a speaker. Yeah, I mean, I do a lot of education. So yeah, as you say, Radha, my roles are very varied. But yeah, I mean, the most important one for me is that activism and that campaigning and making change for the future for all of those women who will come behind us.
Yes, you are pioneer, and we have a really, really deep respect. And we really love you. Because of you, so many menstruators who are struggling for perimenopause and menopause, they have a voice right now. And huge congratulations to you and your team for incorporating the menopause into the school curriculum, and also the plan for inception of menopause in medical schools since 2024. It's a really, really, really historical change. Congratulations for it.
Yeah, I mean, there have been, you know, since I started campaigning sort of a long time ago now, there have been lots and lots of others who have raised their voices too. So it is very much a team effort, but we are definitely moving in the right direction. And I really hope that what we are achieving here will help those in other parts of the world who are raising their voices too, to sort of to make their message louder. So I hope that what we do here won't just affect the UK. I hope that it will encourage others that what they're looking to change in their own countries is possible. It's not easy, but you know, sort of with the right sort of pressure being brought, it is absolutely possible.
Yeah, true. In Nepal, not only Nepal, while we have been talking with the different friends all around the globe through the Global South Coalition for Dignified Menstruation, menopause is still not much interest of many of my friends. And while we talk about the menopause in school, or school curriculum, and no one like to hear. Would you
Yes.
elaborate with the examples? Why do we need menopause in school curriculum?
Yeah. So I think when I speak to both women and men, they all say to me, well, I don't know anything about it because nobody ever talked to me about it in the home, and I never learned anything about it at school. So I think the reason that it's such a sensible thing to do is that if we all learn about it, perhaps in our teenage years, perhaps when we're 13, 14, 15, if we all learn about it there. So if we teach everybody about it in their teenage years, it means that not only will it help them perhaps to understand what is happening to their mother, their grandmother, their other family members, it will also perhaps help them to understand what's happening to some of their teachers. All of those individuals will grow up either to experience menopause themselves or to know somebody who is experiencing menopause. So whether they use that information for their own personal experience to help them to recognize symptoms if they're going to have them and get the right help and support, or whether they're going to use that information to support somebody that they know or love. So whether that's in a personal relationship, whether that's a friendship, or whether that's in the workplace, it means that more information gives us all a greater understanding, and hopefully that leads to more kindness and more compassion for everybody. And where I'm sitting, I think that more kindness and compassion and understanding in the world can only be a good thing.
Thank you. I'm still like to know more because you mentioned about the teenagers, 13, 14 years. That means in Nepali context, they are in grade 7, 8, something like that.
Yeah.
So you are expecting the role of the students is like a primary care provider or primary person who can diagnose the menopausal symptoms among their family members or the school teachers, right? Are you expecting
that? So maybe they can just recognize by knowing what menopause is, when it happens, why it happens, what some of the symptoms can be, and how you can support somebody, or even perhaps signpost somebody in the right direction. I think that could be really helpful. But I also think that, so certainly in the UK, up until now, the teaching has been around female health in schools. It has been that at some point they will start periods, then they will talk about pregnancy, very often how not to get pregnant and what happens when people do get pregnant, but then nothing is taught after that. So that means that for many young people, they will leave their schooling never potentially having heard the word menopause. And of course, for the vast majority, they will be menopausal in perhaps their mid to late 40s, but they will live many, many years after that. So it's not a good example of teaching the female cycle in its entirety. We're only teaching about two parts. We're not teaching about it entirely. So in that case, for many people, they think, okay, so females have periods, they may or may not choose to or want to be pregnant, but there is no understanding of what happens later. And for me, that doesn't make sense. If you're going to teach about a cycle, you teach about it in its entirety.
Yes, it's very true. And that is why the dignified menstruation is for the life cycle approach, not for the pregnancy, not for the menstruation.
Exactly.
It has to go throughout the life cycle, even after the death in some cultures.
Yes.
Thank you very much. And listening you always like a very inspirational. I feel like I'm just next to yours. For our audience, would you explain a little bit about the basic symptoms? How could they recognize after listening your talk? Because many of my friends, they said, "Oh, I'm only 35. I'm only about 40. Now, why did you ask me about the menopause?" So there are so many confusion. As a practitioner, as an expert, would you explain what could be the basic symptoms and from what age we have to conscious? Please, thank you.
Yeah, of course. So it's important to say that there are different types of menopause. So if we start with a natural menopause, so this is where at some point in a person's life, the ovarian function is going to change. That means that the ovaries are essentially running out of the store of eggs that they have. At that point, rather than going through a regular monthly cycle, the hormone levels start to change. And for some people, they can change quite significantly. So as the estrogen level starts to peak and dip more regularly, this is where individuals can start to experience symptoms. So around 1 in 4 probably won't have many symptoms and may have none, but 3 out of 4 will have symptoms. And those symptoms fall into different categories. So you can have physical, cognitive, or psychological symptoms. So physical symptoms, probably the one that everybody has heard of, is hot flushes or hot flashes. Wherever you live in the world, you might refer to it slightly differently. Things like night sweats, perhaps heart palpitations, achy joints and muscles. For some people, their periods will start to change. Now, for some, that happens earlier than others. For some, that could take some time to change. But periods changing doesn't necessarily mean they will get lighter. For some people, they can become heavier. Then there are symptoms that people might never have heard of. So things like dry eyes, dry mouth, perhaps, as I said, achy joints, perhaps itchy skin. This can be quite common. Then the symptoms that people often find very difficult to speak about because very often they're embarrassed, or culturally it could be taboo to speak about these symptoms. So these are things, they're what doctors call genitourinary symptoms. And essentially it means increased urinary frequency or urgency, or perhaps increased urinary tract infections, or perhaps vulval or vaginal symptoms, things like dryness, soreness, irritation, discomfort. And it's really important that we do talk about those symptoms because there are so many women around the world suffering in silence with those symptoms when there are very, very simple interventions that can help to relieve those symptoms for them. Then we have the cognitive symptoms. So often here in the UK, the cognitive symptoms are referred to as brain fog. But what we actually mean are changes to memory and concentration. So perhaps people are struggling with word finding, or perhaps they feel that they're more forgetful than they might normally be. And then we have the psychological symptoms. So very often it's the psychological symptoms that come along first. So, and the most common symptom that I hear about on a weekly basis is increased levels of anxiety. So anxiety, low mood, mood fluctuation, perhaps changes in levels of confidence. And what people will often say to me is, I don't understand why I feel like this, because everything in my life is good. I love my family life is good. My work, I really enjoy my work. There is nothing has changed in my life, but I feel so much more anxious. My sleep has changed. I'm not sleeping as well as I might through the night. Now, typically, if I were to sort of ask people who didn't know about menopause, if I were to say, when does menopause happen and what is it? They would say, well, it's hot flushes and it happens to women in their 50s. Actually, perimenopause can, for many, begin in their late 30s or their early 40s. And that's in a natural menopause. So the perimenopausal phase, for some people, can last several years until they have their final period. And you only know you've had your final period when you can look back retrospectively and know that you have had 12 months without a period. That's when you're officially, according to doctors, that's when you're officially in menopause. But there are other types of menopause that people could experience much earlier. So you could be somebody who goes into a premature menopause. So we often hear from those under the age of 40 who have gone into menopause. Around, in the UK, around 1 in 100 under 40, 1 in 1,000 under 30, and 1 in 10,000 under 20 will experience a premature menopause. There's also early menopause, which is the total cessation of periods between the ages of 40 and 45. Somebody might experience a medical menopause. So this is where they're having treatment or medication for a medical health condition, and that can have an effect on their ovaries. That can be temporary or permanent. And then if, like me, you've had both of your ovaries removed at the same time, that will put you into an immediate surgical menopause. So there are lots of different ways that women will encounter menopause. For the vast majority, it's a natural menopause, but we really need to change the narrative that menopause happens to women in their 50s, because perimenopause happens to many in their late 30s and early 40s. And it's that lack of information that stops people from reaching out for the help and support they need, because they don't know that it's happening to them.
Thank you very much. See, late 30s to 50, it's a huge time span. And then how much they suffer psychologically, socially, culturally, economically is really, really painful and very sad that no one is speaking about it. Diane, would you share what should be done by the individual who have experienced the perimenopausal symptoms late 30s? Because that time they also don't think in that way, and they really kind of feel shocking when someone talk about the menopause. So would you give us some kind of tips to cope with this kind of symptoms, please?
Yeah, definitely. So I think it depends on the depth and breadth and variety of your symptoms of the individual. So as I said, around 1 in 4 will have very few symptoms, but for the 3 out of 4 who will have symptoms, they can have impacts on all aspects of our life. So it could be on your personal relationships, it could be on your friendships, in your workplace. There are a variety of different potential effects. So I think the first thing is, where people can, it's really important, if you have never had any information or education, if this is the first you're hearing about perimenopause, is to try and do some homework. So to find out as much as you can. I just wanted to highlight the International Menopause Society. So the International Menopause Society has information in many different languages. It's a great resource, very useful. So first of all, I think education and information is key. Then thinking about, how can I best look after myself during this time? So can I do things to optimize my nutrition, my movement, my sleep, my rest, and the support that I have around me? Can I gather more support around me? So whether that's from family and friends, or whether that is from a medical health professional. So everybody will have their own preferences for how they manage their symptoms. So that could be culturally, that could just be down to medical history, but everybody will have their own preferences. But it is really important to know that there is potential solutions out there. So for many people, their first port of call will probably be a medical health professional. So many will go and see a doctor. It's really, really important to understand that the doctor that you see may never have had any formal menopause training. So you may be in a situation where you are working with your medical health professional to work your way through this. So you may be the person bringing the information to your doctor. Now, be aware that some are very open to that situation, to having an informed patient. Others are not. So it might mean that you have to see more than one medical health professional. And certainly in the UK, that is still something that happens. We still speak to those who say, I went to see, in this case, a GP, a general practitioner, who told me that they didn't learn anything about menopause. So I've had to see a colleague in that practice. So I've had to have more than one appointment. Now, obviously, I'm very mindful of the fact that not everybody around the world has the facility that we have in the UK of a national health service, which is free at the point of need. I'm very aware of that. And in many places in the world, I know that people are being put into a situation where they're having to find money to make those appointments. Now, for me, this is very idealistic, but I don't believe anybody should have to do that. And for many, many millions, if not billions of people around the world, that is simply not an option. So we really need to do everything that we can, not just to encourage, sort of our communities to educate themselves and to help them with that by providing resources, but also we need to do everything that we can to encourage our governments, our medical health professionals, that menopause education is absolutely vital for us to be able to help approximately 51% of the world's population. So there are some things that you can do to help yourself. Some people will choose to look at alternative medicines. And if that's your choice, then absolutely that's to be respected, that's what you choose to do. My only piece of advice would be, please ensure that whoever you're going to be taking advice from is trained and has the experience and the knowledge to help you safely. That's the most important thing.
Very true. Thank you. And what does mean by the alternative medicine for menopause?
Yeah, so in the UK, the term alternative is used to anything that is not essentially medical science. So those things that we don't get from our doctors. So for some people, they might choose to go the herbal route. Obviously, for many cultures around the world, herbal medicine is absolutely ingrained in their culture. So for many people, they may choose to go that route. And for some people, they certainly find that it helps them. But as I say, the most important thing for me is that whoever you're going to be taking that advice from is not just knowledgeable, but also experienced, and will be able to look at your own personal medical history to make sure that anything they're prescribing for you is not going to interact with any prescribed medication that you're taking. That's really, really important. And then, of course, Radha, there are so many different complementary therapies. So lots of people will find relief in things like massage for their achy joints, in things like reflexology, in things like acupuncture. Now, of course, we don't have any sort of research in these areas because, as we know, research into women's health in general is very limited. So research into anything to do with menopause is even more limited. So we have very little research, we have very little data to point people in the direction of. But I think whatever it is that you choose to use, whether it's what we call here hormone replacement therapy, but in other parts of the world is called menopause therapy, estrogen therapy, or hormone therapy, or you choose to use a complementary or alternative route, safety and knowing the benefits versus the risks is absolutely vital. And that's why I would encourage everybody to have a look at the International Menopause Society website, because you can be sure of good, factual, evidence-based information.
Yeah, absolutely true. Otherwise, alternative medicine may cause the other kind of effect, which is not really good for the health. Earlier, you mentioned about the nutrition and the movements. What kind of nutrition you are referring? And also, would you explain a little bit about what does mean by the movements?
Yeah, sure. So I think I'll sort of give you an example of many of the women that I work with. So when I talk to them about self-care, about how they look after themselves, many of them they'll kind of wrinkle their face, they'll kind of frown and say to me, well, that just seems really selfish. And I say to them, it's exactly the opposite of selfish. Self-care is about looking after you. And by looking after you, you can be your best for all of those around you. But for many women, they're working, they still potentially are looking after family, they perhaps have taken on responsibility for looking after perhaps older relatives or wider family. So they have lots of plates that they're sort of juggling. There's lots of things that they're trying to manage. and perhaps their own self-care is at the bottom of their priority list. So I say to them, you know, what does your nutrition look like? Sort of how often are you eating during the day? What sort of quality is your nutrition? So for many people here, they get through their day by drinking a lot of coffee. So I say to them, are you aware that coffee has both a half and a quarter life? So you get your initial hit from your coffee. So, you know, kind of you're wide-eyed and raring to go. But do you know that that can last for many hours afterwards? And that can have an impact on your sleep. So perhaps if you want to have some coffee, keep the coffee to the first part of your day. Don't have coffee after lunchtime. You know, are you eating a good, healthy, balanced, nutritious diet? So are you eating a diet that is very good for you? Or are you eating lots of fast food, lots of kind of microwave food? Are you eating lots of vegetables, particularly? Are you eating a rainbow of vegetables? Are you eating a good amount of fruit? Are you making sure that your protein, your carbohydrate, are you making sure that it's balanced? So I think it's a really good opportunity to review our diet, what I prefer to call our nutrition, reviewing our nutrition, reviewing our movement. So how much movement are we doing in a day or a week? Are we somebody who now spends the vast majority of our time sitting at a desk? Are we, because for many of us, sort of historically, our work would have been perhaps outside. You know, we would perhaps have been farmers, and all of the work associated with perhaps growing food or caring for livestock. But for so many people around the world, life has changed dramatically. And they're now in office-based situations or in factory situations where they're either standing or sitting in one place for long, long periods of time. And that's not good for us. It's not good for our circulation. It's not good for our heart. It's not good for our lungs. You know, it's not good for our joints. We should be moving. So if you're in a situation where you have a very sedentary lifestyle, then it's a good opportunity to think, okay, I'll start simple. I'll start with something like adding 2 short walks into my day. For lots of people, when they were younger, they may have engaged in sport or perhaps a pastime that they really enjoyed. It might be yoga, Tai Chi, Pilates, etc. But maybe as their life has gone on and they have got busier and busier, perhaps those things have gone by the wayside. I think it's really important that we re-engage with those things that don't only help us physically, but are also good for our mental health too. So I think nutrition is really important. Movement is really important. Optimizing our sleep as much as we can. So, you know, sort of, as I say, cutting out the things that are going to have an impact on our sleep. So things like caffeine, alcohol, cocoa, chocolate, all of those things can be stimulative. So don't have them just before you go to bed. If you're somebody who is really struggling with hot flushes and night sweats, obviously speak to your medical health practitioner, but also do what you can to optimize your sleep. So perhaps if you can, have cotton bed clothing. If you wear nightwear, try to make that cotton. If you can do anything that cools your bed, so, you know, whether that's having a cool pad, that can be very helpful. But all of the simple things, so not making it too overwhelming. And then finally, this is a really difficult one because, you know, we never know what each individual is going through. But I think trying to do something to help manage your stress levels. So for so many people around the world now, they are feeling overwhelmed. They are living with very high background levels of stress. So one of the really simple ways to help to manage your background stress level is by engaging in a simple grounding or breathing practice on a daily basis. And it doesn't have to be complex. You don't have to wear any special clothing. You don't have to be in a special place. Your breath is always with you. And it's really important that we manage it the best we can. So doing something very, very simple by, on waking, using the breath by having a very simple practice where we breathe in for a count of 1 and we breathe out for a count of 3 means that we're spending more time in our parasympathetic nervous system. And that, over a period of time, even a period of minutes, helps us to relax a little more, both body and mind. And then a simple grounding practice. You know, if you have a morning drink, if you have, for many people, it's tea and coffee. For me, it is hot water with a slice of lemon. If you're lucky enough to have outside space, go out into that outside space, and before you turn to whatever it is your day holds, just spend literally 2 or 3 minutes with your bare feet on the grass or the sand or the ground. If you're lucky enough to have water flowing by, in the river or the lake or the water or the sea, and just focus on that breath for 2 or 3 minutes. That will help to ground you for the day ahead. And if you then repeat that breathing before you go to sleep, that means that you're beginning and ending your day in a place where you feel that you have taken back just a little bit of control over your day.
Wow. Thank you so much. Each tips is very, very much logical and moved. Thank you so much. I don't have a word to express my gratitude.
My pleasure.
We discussed about the role of an individual, and then we discussed a little bit about the role of the partner or husband. Usually the men are not like to listen. Sorry for that, but let's make them listen, please.
Yeah, 100. Yeah, absolutely. I mean, I think, again, I think around the world, men are starting in a very difficult position because, like all of the women around the world, none of us get taught anything about it. I also think that there are, you know, sort of within certain cultures, it's more difficult, even when the information potentially could be available, to talk about these things. But I think what we need to do is, in our very personal relationships between partners, we need to be having these conversations. So even if you can't have them more widely with your friends or perhaps your peer group, it is very important that as husbands and wives, as partners, we do talk about these things. Because my experience of working with mainly women, but more, you know, sort of more often now, men who are seeking support to understand how they can best help their wives and partners, I think this lack of information really does everybody such an enormous disservice, because what we see is we see the breakdown of relationships. We see the breakdown of understanding. I have spoken to far too many women who have told me, if I had had this information before menopause came along, I think it would have saved my marriage or my relationship. And that's heartbreaking to look back at that. So I think equally, I would encourage all men to do some research, to understand a little more about menopause, because the person that you probably spend a significant amount of your time with is going to potentially be going through this for more than a few months. It is potentially going to be some time from perimenopause to postmenopause. Not only is it important for you to understand what she's going through, it's really important for you to understand how you can best support her. So whether that is supporting her by attending a medical appointment with her, whether it is supporting her by asking what it is that she needs from you right now. So I know that many of the men that I've spoken to say they try to fix it, they try to make it better. Well, you can't make something better unless you know what the individual who is experiencing it needs from you. And sometimes they're not going to tell you. So you are going to have to ask. But once you know, you can understand a little more about the very practical things that you can do. Are there things around the home that you can take responsibility for while perhaps she is experiencing lots of joint aches and pains? So if somebody is sort of physically struggling, then what can you practically do that perhaps you haven't done in the past? Can you take a little more responsibility for any children who are still in the home? Is there more that you can do there? And remember that this is temporary. This is not going to last forever. But in the same way that partners care for each other in other situations, this is exactly the same. This is the same as if somebody had fractured an ankle or an arm. It's a temporary thing, and we step in to do what we can to make the load lighter. So this is exactly the same. It's also being a listener. When I speak to women, many of them say to me, I just don't feel heard. I don't feel heard in my workplace. I don't feel heard by my medical health practitioner. I don't even feel heard in my own home. And it's so important for us as human beings to feel heard by another person, particularly the one that we share our lives with. Also understand that perhaps your partner doesn't have control over those symptoms. Perhaps one day she feels happier than another. Perhaps one day she feels tearful. It's learning to understand that this is part of the menopause transition, and that any help and support that you offer will help your partner as she goes through that transition. Recognize that this is nobody's fault. There is no fault here. It is just part of the life transition. But if we are truly supportive of our partners and our wives and our husbands and our wider family and friends, then we will be adaptable and we will change with them so that we can offer the support that they need when they need it. It's also very much about keeping the conversation going. It's so important. So one of the areas, Radha, that often is very upsetting is working with those who are experiencing those genitourinary symptoms. And so they no longer feel that they can be intimate with their partner, but they find it very difficult to speak about. And this is really upsetting, because very often I will speak to those who are continuing intimacy, even though it's painful for them. And nobody anywhere in the world should be in a position where they are having any kind of intimate relations where they are in not just pain, but any type of discomfort. Now, very often they haven't spoken to their partners about this because they find it very difficult to talk about. So it's so important for those partners to understand all of the potential symptoms of menopause, so that they can recognize that if their partner or their wife is trying to avoid them, if they are very reluctant to engage in any kind of intimacy, that could even be a hug or a peck on the cheek, a little kiss on the cheek, that's because they're struggling to have that conversation, but they know that intimacy is going to be uncomfortable or painful for them. So it is keeping that line of communication open and being open to learning is absolutely vital.
Yeah, very moving. And let's do the appeal to all real partners, real husband, real man, to initiate the dialogue with the partners, with the wives. And please be listen carefully, and please do research, and please do provide the support whatever you can. And you are the second doctor for your partner or your wife, and you can really make difference to overcome with the menopausal symptoms.
I think the other thing as well that's really important to say is that by you being open to learning and having this conversation, if you have children, if you have sons and daughters, if you have nieces and nephews, you having those conversations is going to make the future better for them. Because the more we have the courage to speak about these things and raise our voices in all of our communities, the more we are going to normalize the conversation of menopause and make it something that is not a challenge for those who come in the generations after us.
Yes, very true. And this kind of conversation, this kind of support is all about the dignified menopause.
Absolutely.
It should be done in a dignified manner,
Absolutely.
with respect, with love, with humanity. It's not for domination or discrimination or kind of suppression or some kind of exploitation. It should not be like
Absolutely.
that. It should be done in a dignified manner.
Absolutely.
Earlier, you discussed about the dignified menopause in the workplace in UK. Would you explain a little bit about what look like in workplace right now in UK in 11 years discourse of menopause campaign?
Yeah, so things have changed quite significantly in the UK over the last few years. So since I started campaigning several years ago, there has been actually quite a lot of work in the menopause space in the workplace. So we now have lots of organizations who have menopause guidance. Some of them will have a policy, but policy is quite frankly not worth the paper that it's written on if there is no culture to underpin that. So if there's no supportive culture, there's no point having a policy. So there's guidance. For a lot of workplaces, they now have menopause support groups within the workplace. Some of them have menopause champions in the workplace. And much of this is driven by passionate women within their own workplace who have had a difficult time and essentially have campaigned to their employer for menopause to be better understood. So I will often either go into or provide educational webinars for businesses and organizations. I have many colleagues here who do something similar. And that's really about giving that basic level of understanding to everybody within the organization. So the workplace can be such a useful place for people to get that information because they might not get it elsewhere. So we now have, in the UK, we have a government workplace ambassador for menopause. So she is doing some important work to improve resources for all employers. I'm currently working, well, we've just released a 5-minute animated film about menopause, which is free to everybody. So every employer can use that. We recently published a new Understanding Menopause guide as a PDF so that everybody, it is only in English at the moment. I am hoping at some point to translate it, but that's available to everybody around the world to use for free. So there are lots of good free resources, but I think, again, Radha, it comes down to education and information and making sure that everybody in the workplace understands that, and also changing the narrative. You know, we still hear from those who are not treated well experiencing menopause in the workplace. And I think, you know, you used some very appropriate words. It's about dignity, it's about respect, it's about humanity. And as I said earlier, it's about compassion. So I think we need to have that in all aspects of our lives. But I think we are definitely going in the right direction. We won't have got it right until every employer, whether they employ 1 million people or one person, has an understanding and also a pathway for those individuals to follow. So it's not just about saying we're doing the right thing, it's about having the right actions in place. It's very easy to say, you know, sort of, oh, we're doing the right thing for menopause. But actually, it's about what the people who work within that organization say their experience has been while they're experiencing menopause.
Very true. And I like the word menopause ambassadors. And Global South Coalition for Dignified Menstruation is claiming to revise the organizational policy. Each organization, from UN to the village council office, has a gender equality and social inclusion policy, but they never ever talk about the discrimination because of the menstruation and menopause. It's really, really sad. We have to change our policies, and we also have to incorporate the dignified menstruation, including menopause, into
Absolutely.
our HR policy, financial
Yes.
policy. And we have to put the condition in our contract letter while providing the contract letter to each employee. And this is how we can create the enabling environment for the each menstruators to work in a very dignified manner, and we can achieve the decent work according to the SDG 8. Right now, I always unhappy arguing with the UN. They keep talking about the dignified work according to the SDG 8, and they talk about the salary, they talk about the safety, they talk about the other kind of things, but they never talk about the menstrual discrimination throughout the life cycle, and that is so much heartening for me. And let's make a kind of campaign from global north to global south and from east to west. And one day our sisters, our mothers, our daughters, our granddaughters will live with a dignified manner wherever they are, at home, at school, at community, at workplace, at parliament, everywhere. Even in the moon, one day they will be in the moon. We cannot imagine any place where the menstruators are not. So that is why this is very, very important. We are very close with our time. Let me do some announcement. Please follow the Myanmar conference. There will be the menopause and dignified menstruation session. It is freely available. It will be in October 14 and 15. And also, I encourage everyone to do some kind of activities around 5th International Dignified Menstruation Day. And also, if you need to get any information how to celebrate the 5th International Dignified Menstruation Day, the resources, the toolkits are available in German, in English, in Spanish, in Nepali, in our website. Please follow us. And actually, I don't like to stop the conversation. We have so many things to say, to share with you all, and I think we will have another conversation again when we will figure out the time. And we wish very dignified menopause day, everyone. And please at least start the talk at your home, at your workplace, at your wherever you are. Even if you are traveling in bus, public bus or train, just talk about the dignified menopause. Today is the dignified menopause day. Let's have a talk. We need that kind of talk, and we can make this happen together. Thank you very much, Diane. Yes, so I don't have a word to express how much I'm happy, delighted to have you. Please end our conversation with the key message, last message to our audience.
I think my key message is that menopause is going to happen to half of the world's population. It's going to have an effect on the other half. There is nobody on the planet who is going to go through their life not knowing somebody who experiences menopause. And if we want to make life better for everybody, if we truly want to make this a dignified experience, then we have to understand, we have to educate ourselves, we have to be more compassionate, and we have to be kinder to each other, because kindness not only changes lives, but occasionally it saves them.
Thank you so much.
It has been my absolute pleasure. It's so lovely to see you again. Thank you for inviting me.